So the most exciting part of my talk is the clinical telehealth examples. So we have to find innovative ways to support our partners. And in the past, we have supported pilot projects throughout Alberta. And I'm going to talk to you about some of the successful ones that are ongoing or that we're very proud of. The first one is the Siksika Nation in southern Alberta and the Calgary Health Region are involved in a collaboration to extend a numerous number of Calgary Health Region-based services to the reserve by telehealth. So they're currently looking at 4 or 5 priority areas based on their needs. And it's pretty easy to brainstorm what they are if you know a little bit about First Nations, but it's diabetes care, it's mental health. They're also looking at discharge planning and sort of home care with wound care management, and a couple other areas. So what's currently happened is Calgary Health Region has supported the community in accessing Alberta SuperNet, and they are providing the provider the access. Sorry, I'm getting some interference here. I hope you're hearing me okay.
We can hear you, Chris. Just another 2 minutes.
Okay, I'll continue the. So that service. I hope someone has their mute button on. That service is connected to various specialty programs in Calgary, and excitingly, there's a psychiatrist involved, and she actually conducts the sessions from Canmore, so she's based in a regional facility.
I'm not sure why it suddenly accepted this time, and I'm getting full audio and full video here. So
we're getting background noise. Who's ever speaking, could you mute your speaker, please?
Okay, I'll continue. So a psychiatrist is providing mental health services to the mental health team and to clients on reserve. They are looking at other program areas related to diabetes, endocrinology, wound care, and actually nephrology, which is renal care, and dermatology. They're looking at a pediatric focus as well in the future. Part of that project has also enabled this clinic, the Elbow River Healing Lodge, to access some of the services as well. And they are linking primarily in mental health. This room that I'm in right now is a counseling room. You may be able to see behind me a screen that has allows observation of interviews. And so this program has also enabled the health region to better link to some specific psychiatric services for the patients that I see here. There's a nursing virtual clinic that's focused on diabetes that is based out of Fox Lake, and that's just had 2 initial sessions, and it's one way of providing nurse practitioner-based care to a remote community where previously they had to bring complex diabetic patients to Edmonton or to High Level or Fort McMurray for diabetic services. The final one is a forensic psychiatry program in Eden Valley that also is linking patients and psychologists back to a psychiatrist in Calgary through basic video conferencing. There are other areas of focus that are happening. One of them is primary care, and one community named Fort McKay is actually linking to a physician that has been providing care to that community for a number of years, and he's currently based in New Brunswick. So he's actually linking to their community, and he also goes directly once or twice a month. Finally, I just wanted to let you know, this is the last slide, that there's other activities that our communities are using broadband connectivity for, related to things like epicenter concepts, which is a way of providing surveillance information to community-based health staff through web-based platforms like Illuminate and Microsoft SharePoint, all enabled by reliable connectivity on reserve. Some communities are looking at their capacity for holding data, and that's important to First Nations self-determination. And then some communities are pursuing the opportunities of digital x-rays to facilitate rapid interpretation and feedback of x-ray results. They're also accessing things like provincial databases for lab results. So lots of really exciting things happening on reserve. Thank you for your time. And I will mute myself now.
Thanks so much, Chris. We do have a question. I know your schedule's quite tight, but we do have a question. Do you know if broadband is being used to access or deliver non-traditional medicine as well?
That's a good question, and that certainly would be our hope. I know that many bands, once we build it, they do whatever they want. For example, the Blood Tribe in the South is using it to link to various services even in the States that I'm not even aware of. Certainly, Health Canada is there to enable the access, and I'm not sure of a specific example. I know in this clinic, the Elbow River Healing Lodge in Calgary, we have a mandate to look at traditional health, traditional activities, and so we would be using this technology or allowing it to be used. But currently, it's basically we're building it, and they're going to be choosing the applications, and so certainly I see down the road an opportunity, should communities want to pursue that, whether it's within Alberta or externally in Canada or across the world. I think that they will, for sure. It's a priority of most of the communities as well.
Excellent. Thanks so much, Chris. And you've graciously provided us with your email address here. So if anyone else has further follow-up questions, email Chris. And we appreciate all the work that you're doing for healthcare on your Tuesday to Thursday